Hi everyone, welcome to Taping Tuesday. It's Greg Diamond, Senior Physio down here at Cottesloe. Now I'm going to do a Kinesio tape for an Achilles tendinopathy. What I've done here is I've prepared my length by just laying the tape down so that it covers the bellies of the gastrocs and running down over the heel and into the midfoot. Now I've rounded the edges just so that tape won't catch when it's on and won't peel off. I'm now going to cut down a length of the tape right in the middle because I'm going to form two slips that will encompass the gastrocs. Now I've already worked out that I'll need about 5 of the big squares of the Kinesio. I'm now going to just break that tape at that level so that most of the tape remains on backing. Now I'm going to peel that off there. If I hold the end, I can control that. With the tape covering the actual Achilles part, I'm going to apply a bit of light traction on that band of the tape, probably about 25% kind of pull. Lay the tape down. Remember that the end of the Kinesio tape should just be placed on the skin. Try not to apply it with any tension because it may irritate on that attachment. We're going to do the same with the other arm of the tape that we've already prepared. And we're going to lay that down again, kind of encircling almost the belly of the gastrocs. Now the end of the tape, again, we're just going to place on the skin. We're not going to place it with any traction, but this part I had about a 25% piece of, or a bit of traction applied, a bit of stretch. Now I'm going to peel off the base here. I'm going to keep a little bit of tension on that. Now I'm going to ask Katie here to pull her foot up into a bit of dorsiflexion because we actually want a bit of stretch on that tape, on the tissue as we apply the tape. Also, the tape has a little bit of stretch. Don't get too carried away, probably 10 to 20% of stretch, laying it down over the tendon, running it over the heel into the midfoot, and then when I get to the end, again, not tractioning that, but just applying it without traction. Smooth that down. Now, Kinesio tape always apply with a little bit of heat because it just helps the gum set. The idea being, you can now relax your foot, Katie, that the tape that encircles the muscle, with Kinesio tape, if you're taking it from insertion back towards origin, you apparently produce some relaxation. So you're detensioning the muscle. Down over the tendon, you're lifting the dermis and creating better lymph flow over the part or the active inflammatory component or tendinopathic component. And then you've got your anchor well and truly over the heel and down to the foot. You can also incorporate this with a greater length to the base of the toes, and there's some sections that you cut out of that can make fingers of the tape for a plantar fasciitis if that's also a part of the clinical picture, but we can perhaps demonstrate that at a later date. These little, where you can see a bit of the tape has formed a little ridge. You can just trim that ridge. That should, without taking the skin of the patient away, that's fine to do that. And that should be quite comfortable. With a bit of luck, will help in your management of Achilles tendinopathy.